Welcome. Thank you for joining us today. My name is Stephanie Patton, and I'm the Prevention Coordinator for the Oasis Coalition. And today I have with me Todd Brown, who is a member of the Oasis Steering Committee. He's a parent, and he is a pharmacist. So thank you for joining us. We Are United for a Healthy Stoughton is a new series that I will be hosting to talk about a variety of healthy living issues here in Stoughton. I will be bringing a number of guests to share with you some of the exciting things that are happening here, as well as ideas and suggestions for keeping the youth and other community members of Stoughton healthy. Today, we are going to be talking about prescription drug abuse prevention and medication safety. So what you can be doing about keeping kids and other folks in the community safe from harms related to prescription drug abuse. So to start with, I just want to give you a little bit of context about the coalition. So Oasis was founded in approximately 2004. The focus of our coalition is to really focus on keeping young people safe from alcohol, drugs, and drugs, and here in Stoughton. And our mission is to work collaboratively to reduce youth substance abuse by reinforcing healthy community norms, decreasing youth access to alcohol, tobacco, and other drugs, and creating sustainable policy changes that will support healthy youth choices here in Stoughton. So I want to start out with a little bit of context and really talk to you about whether or not there is a prescription drug abuse problem in Stoughton. So nationally, what we know, and we can look at the graphic here, that across the country, by 2010, drug overdose deaths have been outnumbering motor vehicle traffic deaths in over 31 states. It's true in Massachusetts, and by 2012, we were seeing at least 13 Massachusetts residents dying every week from drug overdoses. So we are facing a challenge in Massachusetts. Those drug overdoses are often related to prescription drugs or heroin. Here in Stoughton, we can look at what's happening with opiate overdoses specifically. So this graph shows what's been going on in the last 5 years. So in 2010, we experienced 32 opiate-related overdoses in Stoughton. This year, up till the end of October, I think the chart says September, but it's actually October, we've had 42 overdoses so far in Stoughton. Unfortunately, those numbers are trending up. That's happening across the Commonwealth. That's not a Stoughton-specific issue, but it's something that we're very concerned about. The good news is that the other number that's up is the number of reversals of overdoses that the police are having due to the fact that they carry now nasal naloxone or Narcan. So that's a good piece of news, but we would like to be in a place where we are decreasing the number of overdose deaths, and the way we really can be doing that, and this is the role of the coalition, is really to be preventing people from getting addicted to substances like prescription drugs and heroin in the first place. So really trying to take a step back and think about what are the precursors to drug addiction. So we always think about addiction as developmental disease. And what that means is that the age at which people start using drugs and alcohol often is in the teenage years. So if you think about the age that people first experiment with things, you can see on this chart, this is national data, this isn't Stoughton specific, but typically teenage years, not surprisingly, are the time of life when people start experimenting with drugs and alcohol. What we know about that is that the younger kids start experimenting with drugs and alcohol, the more likely they are to have addiction issues and other consequences related to drugs, and the more likely they are to progress from things like alcohol and marijuana onto other drugs. So I can show you a little bit of Stoughton data here, what we know about what's happening here at Stoughton High School. So we're very fortunate that we're able to collect data from our students. This is something we do every other year. It's completely anonymous. It's confidential. There's no way for us to identify any individual students. And the chart that you see now really looks at drug use that students report that they've ever used any time in their life. So we see that it's actually less than 50% slightly of kids who ever report having used alcohol. And these numbers actually are reflective of the entire Commonwealth. And actually, if we can flip back to the chart for just a second, you'll see that prescription drug use is just below 9%. So this means they've ever experimented with it in their life. It could be one time. And heroin use at Stoughton High School is below 1%. That number has been trending down. So that's good news. Those numbers aren't super high, but we are still very concerned about them because they are very dangerous drugs. All drug use is dangerous, but we are also paying close attention to prescription drug use and heroin. And then to break that apart a little bit further, I'm going to show you one more chart here, and then I'm going to turn things over to Todd. If we think about the kids that say that they're using prescription drugs, we can actually break it apart by the type of prescription drug they're using. So of that small percentage of students, 61% of the kids, 61% of that 9%, report that they were using stimulants. Just below 60% report that they're using pain relievers, and then we see sort of other types and tranquilizers. So the top challenges with drug use here are pain relievers and stimulants, which can be things like ADHD drugs and other drugs of that sort. Okay, I'm going to turn it over to Todd, who's going to talk about opiates.
Thanks. We're really concerned about opiates because we've had a lot of problems with opiates and opiates leading to heroin. And so first, probably want to backtrack a little bit and talk about what's the legitimate use for opiates. So opiates are used for pain, and they're very effective in certain circumstances. They actually dull the sensation of pain, and so they reduce the sensation and allow for treatment of pain. When we talk about pain, we talk about two different categories: acute pain, which is short-term pain, and then chronic pain, which is long-term pain. And it's important to categorize that because opiates, I think the next slide, opiates are used more effective in short-term pain than long-term pain. For long-term pain, we usually use a combination of other medications. And opiates long-term a lot of times are not very effective. It's important to know that all opiates are chemically related to heroin. So whether it be OxyContin, morphine, Vicodin, they are all structurally related to heroin. And the next slide will show you that. We can see heroin, oxycodone, and hydrocodone. And the graphic here will show you how they're all very closely related. And so what happens is they all work the same way in the body, they all do the same thing, and the only difference is the actual structure of the drug, but they all pretty much work the same way. So it's important to know that these medications, these prescription medications, are really pretty similar to heroin, and we all know how dangerous that is. So it's important that we use prescription medications safely. And so we have some guidelines for you on how you can use medication safely. You always want to take medication that is prescribed for you only. You never want to take someone else's medication because you don't know how that's going to interact with other medication you're on or other conditions that you may have. You don't want to mix multiple medications in the same bottle. It could be dark and you might not be sure what you're going to take. And so you always should keep the medication in separate containers so you have a good idea of what you're taking. You don't want to take medications apart from or different from the way it's prescribed. That's where people run into trouble. If the medication isn't working, you should contact your doctor and talk about that, but not just increase the dose by yourself. A lot of times there's other things that you could take that are going to be more effective than just trying to take more medication or taking them longer than prescribed. Always talk to your doctor or pharmacist about possible interactions with the prescription drugs. They could be interactions with over-the-counter medication. They could be interactions with other conditions or other food that you're taking. And so your doctor or your pharmacist can give you good information about how to avoid those harmful interactions. You want to keep an updated list of your medications. You should bring that list whenever you go to your doctor or your pharmacy so that everybody knows all of the medications you're taking. This will help you avoid harmful interactions and prevent you from getting into trouble taking medications that shouldn't be taken together. That's probably the biggest problem that we see in the medical system, is that healthcare professionals don't know all the medications you're taking could be because you're getting them from different sources. And so if you can have a list of all the medications that you're taking and bring that with you, that will help solve a lot of problems. When you're done with your medications, you want to dispose of them. People want to hang on to them. They want to keep them in the house in case they have a similar condition in the future. But once again, your situation might change, and just because you used a medication 2-3 months ago, it might not be the best medication now. And so really, the best course of action is when you're done taking the medication, dispose of it. And we'll talk a little bit later in the show about how you can do that. You want to stick taking the medication with the way it was prescribed. If you have trouble with that, there's all sorts of tools and resources that either your doctor or your pharmacist can help direct you to help you take medication as prescribed. You want to try to use the same pharmacy or make sure that the pharmacy knows the complete list of medications that you're on. And you want to store your medication in a cool, dry place. And so your bathroom is probably not the best area because that tends to get hot and there's a lot of moisture in there. The windowsill is probably not the best area because it can get hot in the summertime with the sun. So it's better to keep them out of sight, either locked up or in a drawer where people can't see them, in a cool, dry place. And specifically, what can you do about prescription drug abuse? We know that the top reasons why youth start abusing prescription drugs is they get them usually from parents or friends. And so that's why we want you to, when you're done with prescription medication, remove them from the home, and while you're using them, keep them out of sight so that you decrease access to others with these prescription medications. They abuse them because they're available. They don't think they're harmful because they're legal. You've got them from a pharmacy. Oftentimes they can be less expensive than illegal medications. People think they're safer to use, and they could be safer to use if used as prescribed, but when you use them in a different way other than what's prescribed, or for someone who it isn't prescribed, they can be very dangerous, and we see that quite often. And then children don't think that parents care if they're using prescription medication, and so if parents can convey this will go a long way in helping reinforce important expectations around prescription medication. Parents, what can you do? The biggest thing is you can talk to your child and your child's doctor about their medication, make sure they're on the safest and most effective treatment option, and really control their medication. Make sure that they're taking them the way they should. Make sure that they're not giving them to anyone else. We see a bunch of medications here, and oftentimes non-opiate medications can be just as effective as more dangerous opiate medications. So if you talk to your doctor or your pharmacist about using alternatives to opiates, many times some of these alternatives can be used with equal pain relief. Parents, you want to make sure you control the medication your children are on. You make sure that they don't share that, make sure they're in the original container, and that they're being taken as prescribed. Also, with regard to storage, you want to make sure they're in a safe place and they're out of sight. You see here a graphic from the district attorney's office, once again showing that first-time drug users get medications from friends or family members or from the medicine cabinet. Once again, it's vital that we store them securely so that our children don't have access to these medications. Parents, you also want to make sure that it's stored properly once again, and it's disposed of when they're not being used anymore. And in Stoughton, there is a kiosk at the police station that's available 24 hours a day, 7 days a week, where you can take your prescription medication, cross off your name, what it is, and just toss it right in that kiosk. and that's available 24 hours a day, 7 days a week. In addition, in Stoughton, during the hazardous take-back days, there's usually a station where you can dispose of your medication, and that is usually offered twice a year. And so that's another opportunity for you to get rid of medication. It's equally important that you communicate to your children about your expectations about both prescription drug and alcohol use. Here's a graphic that shows the last conversation children have had with their parents regarding substance abuse, and the more you convey these expectations about only using prescription drugs as prescribed and not using other prescription drugs, children will listen to that, and that will greatly influence their behavior. And so you want to make sure you talk to your kids about prescription drugs, make sure they understand that when they're not being used as prescribed, they are very harmful, and in the early detection and shortened use of the prescription drugs to only when they're needed will help relieve some of these problems.
Okay, great. So now we're going to talk a little bit about what the coalition is doing to prevent prescription drug abuse. So we've talked a lot about what parents can do and other community members sort of in your own home around preventing some of these issues. Really the role of the coalition is to think about what can we do out in the community to make the job of a parent or a caregiver easier in preventing some of these problems. So we tend to take kind of a broader look. We're looking at policy issues and other types of systems changes that we can make in the community to make your job easier as a parent and to make sure that you have the information that you need in order to really support your child in the best way that you can. So here are some of the strategies that Oasis has been working on over the years to try to reduce prescription drug use specifically. These are only some of the strategies that we are involved with. Of course, the work that we do is very targeted around alcohol, marijuana, and then also prescription drugs. So some of these strategies look the same, and some of them are very specific. So specifically thinking about reducing youth access to prescription drugs. So as Todd shared with you earlier, unfortunately, the easiest way for kids to get these kinds of medications is really out of medicine cabinets of their family members or friends, people that they know. And so really by making that more difficult, we are reducing an access point for kids. Kids aren't really walking into a pharmacy and asking a pharmacist for prescription medication for them to take recreationally. That's not how this happens. So it's really important to really get rid of excess medication and to be in control of that in your house. So as Todd had mentioned, the ways we help you to do that is by making sure at the police station there is a kiosk that is available to you to get rid of prescription medication. As we said, 24 hours a day, the police station's always open. It's in the lobby. You don't have to talk to anybody. You just open it. It's like a mailbox. So you throw the stuff inside, close it up, and walk out the door. Those medications get incinerated every few weeks, basically whenever the box is full. So that's a great option for people to have all the time, whenever you think of it. Twice a year at the moment, we are running prescription drug take-backs in collaboration with the town's Hazardous Waste Day. So we tend to have our station up in the upper parking lot at the middle school. So you don't even have to go in the whole line for Hazardous Waste Day. If you're only disposing of prescription medication, you can come right to our station. We will take care of eliminating any identifying information for you if that's a problem, and make sure again that all of that stuff is properly disposed of, incinerated. It doesn't get into the environment. It's a safe way to get rid of stuff, especially if you have a lot of it at one time that you're trying to dispose of. You're cleaning out your medicine cabinet. When you clean out your attic or your basement, spring cleaning, it's a good time to get rid of that stuff. And at that take back, there always is also a safe sharps disposal. So if you have needles in your possession for whatever reason, for family members, insulin, pets, for anything, you can also get rid of sharps at the take back. We can't take sharps in the container at the police department, but the fire department down on Freeman Street in the center of town does have a sharps disposal available also all of the time for people. We've also been doing some mobile drug takebacks where we've been trying to reach out to seniors and other folks who may have mobility issues and have a hard time getting out of their homes to go to these take-backs, where we're going to some senior housing complexes and with a pharmacist and the police department, the Stoughton public health nurses, and we were collecting medications. We've done take-backs at flu shot clinics at the senior center. We did that this year. So we're experimenting with other ways we can help people to safely get rid of these medications. So we're doing that. We also have been doing a lot of work with pharmacies around making sure that our local pharmacists really are accessing the prescription drug monitoring system, and they're taking full advantage of that to really reduce excess medications and doctor shopping, folks trying to fill prescriptions that don't belong to them, and also, making it also helps to prevent drug interactions if something pops up on the prescription monitoring system that a pharmacist sees because a patient maybe has multiple doctors. We also are doing some strategies aimed at just doing some community education and looking at what are community norms around prescription drug use. So we often share that some of the data that you already saw with our students, with our teachers, with our community members, really reinforcing that most of our students are making really healthy choices when it comes to drugs and alcohol. Most students do not use drugs and alcohol. Most students do not experiment with prescription drugs. They don't use them recreationally. They certainly are not using heroin, and really reminding folks that that tends to be the go-to choice for students, is to not use, and that is a great choice, and that they are among their peers. They're in the majority when they make those choices. We are working with the schools to provide information and skills for parents. So if you have a child in the Stoughton Public School System, you can watch, if you follow the Stoughton Public Schools Twitter accounts or their Facebook, and certainly on the Oasis Facebook page or Twitter as well, you'll see that probably about 4 times a year, in collaboration with the parent liaisons, we offer programs for parents that are really aimed at teaching you how to talk to your kids about drugs and alcohol, identifying issues that might be challenging for you, sharing with you the local resources that are available to families. So those are some great programs. Coming up this spring, we have a program called Hidden in Plain Sight. I believe that's going to be happening in March, where it's a mock child's bedroom. And it gives parents the opportunity to kind of go through this bedroom and look at items that they may not have realized could be related to drug abuse, and kind of find those items early on and have a conversation with your kid before things get out of hand. So that's a great program. It's very interactive. We do this in collaboration with the police department and the Stoughton Youth Commission, probation, and really it's a great chance for parents to ask questions and really get hands-on with some of these products, unfortunately, that young people have in their rooms. We've been doing some education for seniors. Todd has come in and spoken to seniors at the senior center. The district attorney's office has come and spoken to our seniors about medication safety and disposal. We have been doing some community education through the pharmacies. So sometimes you'll see, we try to refill these with the pharmacies when we can, information cards that can go out with prescriptions, reminding folks of safe ways to dispose of their medications and safe use. So, sort of reiterating all of the things that Todd said earlier about only using medication that is in your own name, taking it as prescribed, and then safely disposing of it when you don't need it anymore or when it's expired. We also are starting some work that's pretty exciting with our elementary schools and the school nurses, where we're going to be doing some education with younger kids around medication safety, and really reinforcing not taking things that, especially if you don't know what they are. A lot of medication looks like candy. Even taking too many of those gummy vitamins that kids have can be really dangerous for kids, and so really working with them around what is safe and what is not safe. And so Todd will be working with us in the schools with the nurses and some of our public safety officials to do some education and send home some associated materials with parents. So we're excited about that. That's kind of coming soon, coming attraction. We also are doing some work around overdose. We've actually produced several shows here, which you should look for on Stoughton Media website, around nasal naloxone in our police department. We have been really fortunate. The Stoughton Police were the first police department in the Commonwealth of Massachusetts to independently equip their police officers with the life-saving drug Narcan. And as a result of that work, actually, a lot of police departments in the Commonwealth now carry Narcan, but Stoughton was the first to really push that outside of a pilot project that the Department of Public Health was doing. Our school nurses carry Narcan because our schools are public buildings, and in the event of an emergency related to an overdose in one of those spaces, the nurses are trained to respond to that as well. And we've started some new work with the police and fire department and BAMSI, which is Brockton Area Multi-Service, to do some follow-up work with families where an overdose has occurred in their home and make sure they have the resources that they need to prevent future overdoses and to take care of their families and to keep people safe. It's really part of our larger mission that we care about everybody in Stoughton. And so, our goal as a coalition is really to prevent those overdoses from ever happening in the first place, to really prevent addiction very early on by preventing that starting point with drugs with young people. But certainly, given that we have a public health emergency with overdoses and we have a drug where we can respond to that, OASIS has really been a large part of coordinating some of our community efforts to make sure we can keep our residents safe and provide them with some options and some resources, and hopefully to get people into treatment and out of a terrible cycle. A few other things that are happening in Stoughton that are related to prescription drug safety. We do have the Smart 911 program through the police department. It is an online program. If you have questions about it, you certainly can follow up with the Stoughton Police. If you register for this program, you can enter a lot of your own health information for yourself and your family, including medications you're on. So in the event that you need to use 911, the police department and the fire department will have access to all of that information, which can really help them if a person is unable to communicate for themselves. We also have some programs that are aimed specifically at seniors, the File for Life program and the Yellow Dot program through the Stoughton Council on Aging, and you can follow up with the COA around that, often in collaboration with the fire department. These are forms that people can fill out about the medications they're taking, the health issues that they have going on. So again, if the paramedics need to respond to an emergency in their home or in their car, actually, which is what the Yellow Dot program is about, they have as much information as possible about the patient's conditions and medications, so that as they are trying to deal with the medical emergency, they're aware of everything the patient is taking. So we really are doing a lot as a community. We certainly are open to suggestions and would love to take questions and talk to people more. You can always get in touch with me, and if you're interested and you have questions for Todd, you can reach him through OASIS, through my email address, which is spatton@stoughton-ma.gov. I work out of the Stoughton Youth Commission. My phone number is on the screen. Please follow us on Facebook. We also have a website for people who are not interested in Facebook at all. We have a Twitter account, which also posts to Facebook. So anything that's on Twitter goes to Facebook. And we hope you're in touch with us, and we hope this program was useful to you. So thank you so much, and hope to see you again soon.